When illness begins to limit your life, there are some tough choices that need to be made. Your legacy, your family, your finances, all are important decisions to consider. What you shouldn't have to worry about is your own personal comfort and dignity. Here to talk to us today about this difficult topic are Dr. John Bowden and Dee Lacona from Vitas Healthcare. Thank you both so much for coming on today.
Thank you for having us.
Dee, let's start with you. Tell us about Vitas Healthcare.
Vitas Healthcare is the nation's leading provider when it comes to end-of-life care. We were established in 1978, and now we're very excited to be here in Pensacola.
Excellent. Dr. Bowden, tell us the difference between hospice and palliative care.
Hospice and palliative care are very similar. In many ways, they both work with individuals facing serious illnesses to try to control pain and other symptoms to improve quality of life in these patients. Palliative care will work with folks at any stage of a serious illness with or without curative intent. Hospice care works with patients with a terminal diagnosis that are no longer benefiting from curative treatments.
Okay. Now, I've heard that individuals have to have, a life expectancy of less than 6 months in order to qualify for that hospice care. Is that true? Is it 6 months?
Yes, that is correct. The patients are appropriate for hospice when they're characterized as individuals who have a life-limiting illness with a life expectancy of less than 6 months if the disease process continues on its natural course.
Now, what if it goes beyond that 6 months?
There are recertification periods with hospice in that we don't always do the best job of predicting end of life. It's not up to us. And so we try to do the best we can in controlling these symptoms, improving the quality of life, and therefore a lot of times people do better, live a little bit longer. But as long as they're showing the need for the symptom control and are showing decline in their illness, then they would re-qualify for another certification period under CMS guidelines.
Okay. Now, I know when people hear the word hospice, they probably have a little bit of reluctance toward that word. Maybe they're scared of it or they don't quite understand it.
Yes.
What does that end-of-life care actually look like?
At Vitas, end-of-life care is focused on the patient and not the disease. We want to, as stated, improve their quality of life, control these symptoms, hopefully make life more comfortable and more enjoyable for what time we have. Care is provided by a Vitas interdisciplinary team, including physicians, nurses, social workers, chaplains, volunteers, and other specially trained healthcare experts to evaluate and help control these symptoms, and is provided where the patient is most comfortable in the company of their loved ones.
Now, give us a little bit of the day-to-day of that hospice care. Is it different for everyone, like customized to the individual, or is it pretty standard?
Correct. It is definitely customized to the individual, focused on what their goals are, what the family's goals are in their treatment plan. Their day-to-day may vary. I mean, as we know, dealing with serious illnesses, we may have ups and downs in our days, and we want to be available for whatever their needs are. And so we are there 24 hours a day, 7 days a week to provide what they need. May not obviously be in their home that length of time, but we will, if they need a visit, they need somebody to come check on them, we will provide that. We can provide more intensive services to be in the home if the need arises. It's really what they need at that time. It's a process that they are experiencing.
Fantastic. Now, I understand that Vitas also offers pet, music, and memory therapy. Tell me about that.
At Vitas, we have a tremendous amount of resources additional to the standard hospice care. Paw Pals being one of them, and it's trained dogs with their owners that come and visit the patient wherever they call home. And then we have Lavender Touch, which is, again, we go ahead and train volunteers to go ahead and visit patients and provide the service, which can be very helpful when it comes to anxiety or even just pain management. We also offer music therapy, which is by a professional therapist who will go and do sessions, and it's great for Alzheimer's patients.
Okay. You mentioned Lavender Care, is that right? What is that exactly?
Lavender Touch is performed with lavender lotions,
Okay.
sometimes hypoallergenic, and the lavender smell is soothing. And it's done on the hands, on the arms, and it's just an additional service that we provide.
Very neat. Now, does insurance cover these services?
The Medicare benefit covers hospice care.
Okay.
We do accept all types of insurance, and then needing that the person doesn't have Medicare or isn't qualifying for Medicare, we would never turn anyone down for hospice care if that's what they were needing.
Gotcha. Now, where do these hospice patients generally live? Where do they experience that care? Is it at home? Is it at a facility? Does it depend?
It's wherever they are most comfortable. Again, what their and their family's goals are. Most people we find prefer to experience this at home, be treated at home. That's where they are usually most comfortable. Sometimes their home is a nursing facility, so we go wherever they are most comfortable.
Now, what is the family's role in this end-of-life care, and how do you sort of interface with them as this progresses?
Well, the care is done based on the family and the patient's needs. So the family is part of the care as well, and it's really decided on what it is that they feel comfortable with, and everybody can be different depending on the family size, the dynamics of the family, but they are leading the care.
Gotcha. Now, if someone is interested in hospice care, do they contact Vitas? Are they referred to by their doctor? How does that sort of onboarding process work?
Most folks are referred from their treating physician, whether it be their primary care physician out in the community, or if they happen to be admitted to the hospital, the physician there treating them can refer to hospice.
Okay.
Or even in the community, sometimes we get community referrals.
Right.
Okay.
You know, whether it's the daughter, which is the caregiver, she would call us, or just in the community overall from other, like the Council on Aging, those type of things.
Okay. Take us through that beginning process when, you know, a family is first starting either hospice or palliative care. I imagine there's a lot of discussions, maybe some trial and error with treatment options. What does that look like?
That can vary depending on the situation as well. Again, everything wants to be patient-focused. Depending on the issues at hand, yes, a conversation needs to occur to establish what the issues are, what the situation is, what the patient's goals and expectations are, and what the family's goals and expectations are. And then we can tailor the program to meet those needs and those goals.
Gotcha. Well, it is a difficult topic whenever you're discussing end of life, but it sounds like at Vitas you guys really have a patient-centered approach, and you do everything you can to make sure they're as comfortable as possible.
Definitely, I think that's the most important
Absolutely,
part of it.
absolutely. Thank you both so much for coming on today.
Thank you for
Thank you very
having
much.
us.